Hello again, I'm Marrise Hodges, and welcome to another edition of TIKES Tips. Today we'll be discussing OCD, Obsessive Compulsive Disorder, OCD for short. Children with obsessive compulsive disorders perform repetitive patterns of compulsive behaviors in response to a strict internal rule or because they believe it serves a purpose, such as protecting them. Older children can also talk about obsessive behaviors or thoughts. As they get older, they'll be able to, verbally express what's going on with them. Some young children may not be able to verbalize what's going on with them, so it will just look like patterns of observable disorders such as distress. Children with OCD spend longer than 1 hour a day on compulsions and or obsessions, or their patterns spend that much time accommodating the compulsions. How common is it? Only between 1% and 2% of children are formally diagnosed with OCD. Although the average age of onset of pediatric OCD is around 10 years of age, young children can present with symptoms in preschool or even earlier. The behaviors that are usually seen, compulsions can happen anytime and can include repetitive behaviors about cleanliness, organization, food, collecting non-valuable materials or hoarding, asking over and over again for reassurance about the same thing, or safety for themselves or their family. Obsessive compulsive disorders usually appears gradually. Rarely, if ever, do they just appear overnight out of the blue. There's usually a timeline of events that you can point to. In managing behaviors of OCD for children with this diagnosis, it is important to ask the caregivers about the identified compulsions. What are the things that they obsess over? Is it, toys? Is it butterflies? It could be any number of things, going back to the previous list: food, safety, asking over and over again, same questions, things of that nature. So when in asking the family, try to anticipate what these behaviors will be. And in anticipating what the behaviors will be, try to structure a routine around that so that it doesn't provide or create a challenge for the individual or for that child when trying to manage those behaviors in the classroom. When children are just starting treatment, it is reasonable that when they're trying to adapt, as they say, it'll probably get worse before it gets better. So just try and stick with it for a while, and you should gradually see the behaviors decreasing. Praising the child for tolerating exposure to a compulsion can help. So if you notice that they're wanting to go head first or head on into one of their compulsions, and you see it's taking some time, you see they're getting antsy and things of that nature, praising them for that time period where they didn't give in to the compulsion can be very beneficial. Children in treatment for OCD are taught relaxation strategies. So relaxation strategies, whether it be calming, deep breathing, things of that nature, will help them to be able to tolerate the compulsion and not to act on it every time that the compulsion comes over them. Treatment also focuses on beating back OCD, which is helping the child and the family fight together against OCD. So everyone being in the same boat, being on the same page, working together to overcome the compulsion or the obsession that the child is having to battle with. An example that they have here is, I see OCD is getting in your way right now because it is making you think you can't eat lunch because the food is touching on your plate. Let's fight OCD and do your breathing so you can eat your lunch. So being there present with the child in that moment when they're battling what's going on, for example, with food. If food is touching on the plate, being there with the child in that moment. Here, let's practice our deep breathing technique that we've worked on in the past, and let's see if that'll get us to a point where we'll be able to eat the lunch. Let's remove the part that's touching, separate that, or have a conversation about it in that moment, and praising them for what you've seen that they are able to manage before helping them out in that situation. When you should ask for additional support. A mental health consultant can help tailor expectations for the child with OCD. And if a child is suspected of having OCD, child care professionals should, again, notify the family. We can have a consultant come in, or further evaluation may be necessary sometimes. So if it's a behavior and it's challenging, as in another one of our TIKES tip videos, be sure to ask for help. Reach out to a consultant. Let the parents know so that they can reach out to a pediatrician and try to get further information and further background on diagnosis, what's going on with it, and everyone move forward.